let me tell you my story. So I spent 20 years in the Air Force, and my first 8 years was an enlisted lab tech. Where's my lab folks? Are they still out there? One, two, okay, lab folks. All right, so I was really good lab tech. I finished my degree. I got my opportunity in the Air Force to get a commission as an officer, and so that meant I could move up and become a laboratory director. So literally July 29th, year 2000, I'm an enlisted lab tech, E5 in the Air Force, been in 8.5 years, and I had the opportunity to get a commission, become an officer. That's a Friday, by the way. If you look at your calendar, in the year 2000, that was a Friday. Had a ceremony where they promoted me, and I got my little bars on my shoulder to become an officer. And then that weekend went by, and Monday morning, officially August 1st, I am a second lieutenant, United States Air Force, and I'm a lab director. What was my training to be a lab director? A weekend to think about it. Anybody been there? How many of you had that opportunity? Maybe you didn't even have a weekend, you had like a night. Somebody came to you on a Thursday and said, how would you like to be the leader of this department? Because you're really, really good at your job. You nurses especially, right? Some of you nurses that are out there, really, really good at your job. Let's make you the manager. What does that mean? Better pay. That sounds pretty good. Better hours. Not really better hours, we know that. But it's what happens. And I'm not saying it's necessarily wrong because it's what happens in organizations. But because of that, I spent the last now 17 years really focused on how do we set people up for leadership roles? How do we put them in positions prior to them accepting that role so that they can, as I would say, step in to the role of a leader, which is the hashtag set up to step in. 30 years ago when I started running, it was because I was competing on a regular basis. So my why has even changed over the years. Why do we do what we do? Why do we need to have these elements in place in an organization? Connecting to the why brings us to our purpose. And the purpose is based on the mission and the vision and the values of the organization. Why do we do what we do? Because our values say we have integrity, we have respect, we have quality, we have teamwork. That's why we do what we do. Why? Because we want, one of our values is service, because we want the very best for our patients. So we do this, and this for our patients. Connecting to the why, the purpose, making a difference in healthcare today.